So this is random factlet number 3 from Veterinary ECC Smalltalk. I want to talk to you about bradycardia in canine hypoadrenocorticism or Addison's disease. When most people think about bradycardia in this disease, their mind intuitively goes to hyperkalemia as the cause, which is completely reasonable because it is the most significant thing that we have to bear in mind in these cases. But it's important to realize that it's not the only reason why an Addisonian dog might be bradycardic. And you will see some cases where the patient has a bradycardia and yet their potassium turns out to either be normal or maybe only mildly elevated. And we need to consider what other potential causes there may be of this bradycardia. And these could include, for example, things like the fact that these animals have a cortisol deficiency. Cortisol is important in the appropriate function of a wide variety of systems and organs in the body, and that includes making sure that the heart beats not just at a reasonable strength but also at an appropriate rate, and so cortisol deficiency can lead to bradycardia. Another potential mechanism is raised vagal tone. We know that Addisonian dogs often have intra-abdominal abnormalities, including and particularly related to the gastrointestinal tract. And again, that can lead to an increase in vagal tone that may be a contributing factor in these patients. And then you can also have things like hypoglycemia, hypothermia, and so on. It's important to remember that Addisonian dogs may have an absolute bradycardia or it may be a relative bradycardia. What we mean by that is that for an absolute bradycardia, what we're saying is that for this patient in front of you, given their individual signalment, what would you expect their heart rate to be? And if it's lower than the normal range for that individual patient, then you would consider that to be an absolute bradycardia. But it's also important to remember that some patients will have a relative bradycardia. So you look at the patient in front of you, patient's in an Addisonian crisis, is in shock, has cardiovascular compromise, and that patient should have a compensatory tachycardia. And if you find that in fact their heart rate is actually within normal limits, then we would consider that to be a relative bradycardia. The other thing is, what is the incidence of bradycardia in Addisonian dogs? It's definitely not seen in all dogs, and depending on what literature you consult, it may be as low as 20 to 30%. Having said that, my own view is that dogs presenting actually in an Addisonian crisis, the incidence of bradycardia is probably higher than that figure quoted, but nonetheless it's important to remember that we're not talking about 100% of dogs. So you should consider Addison's in any shocky dog, but especially ones without tachycardia. But also remember that bradycardic Addisonian dogs may have normokalemia, or they may only have a mild hyperkalemia, and in those cases those other contributing mechanisms that we spoke about may be more relevant. It would be wrong of me to having any kind of learning material on Addison's without reminding you that we need to consider it to be the great pretender. And so in any dog presenting with a wide variety of clinical signs, you need to keep Addison's in your list of potential differential diagnoses.